how do I know that this is a 22-year-old female athlete that presents with jaundice? It has to be hereditary spherocytosis because I can complete the differential of hemolytic anemia. Because the first question is going to be, is it immune or non-immune? And I'm going to do an anti-human globulin test. So if that's positive, it's going to be immune. And 90% of these are going to be one of two conditions. They're either going to be lupus or they're going to be CLL. Okay, well, who gets lupus? The answer is 90% have a malar rash and 90% have arthralgias arthritis. So if I've got a female athlete who's well but for her jaundice, it isn't lupus. And then you say, well, who gets CLL? Well, over 65, degenerative neoplastic. So these tend to be old people. So right off the top, I'm not betting lupus and CLL. So then we say, okay, well, how do we approach the non-immunes? And these are going to be mostly my congenital hereditaries. And then you say, well, how do you think about a red cell? Well, I sort of think it's a membrane that's filled with its major protein, which is 95% hemoglobin. And then you throw in a handful of enzymes as antioxidants. So that's going to give me my three non-immunes. It's going to give me my membrane, which is HS. It's going to give me my hemoglobin, which is going to be a hemoglobinopathy. And in America, those are all going to be sickle cell. And then it's going to be my enzyme deficiency, which is going to be G6PD deficiency. Okay, well, if it's going to be sickle, it's going to have to be homozygous. They're sick as little kids. They're not 22-year-old female athletes. And if it's going to be G6PD deficiencies, yeah, these are X-linked. So she's a female. So what am I left with? I'm betting HS. And to me, that seems very straightforward.